Hey everyone! So in today's video, we're going to be talking about Arnold Pick and how he describes Pick's disease in 1892. Here's a little history on Arnold Pick. He was a psychiatrist from Czech Republic, born of German Jewish descent. He was born in Moravia in 1851. After his years of working, he retired and struggled often with cataracts and urinary tract stones. He had bladder surgery in 1924 and eventually died of urinary sepsis. During then, he studied a lot in Vienna. He studied medicine with Theodor Meynert, who was a neurologist, and basically sparked his neuro interest. After that, in 1875, he obtained a doctorate and worked alongside Karl Wernicke in Berlin. He had the opportunity to work at two separate universities, University of Prague and the German University in Prague. At the University of Prague, he was the head of a psychiatric ward in a clinic, and he later became the director of a mental hospital in Dobrindt. At the German University of Prague, he had the opportunity to be a professor of psychiatry and also worked in the psychiatric clinic. So let's dive into what Pick's disease is. Pick's disease is a form of dementia. So more specifically, it's called frontotemporal dementia, FTD, for short. This is a neurodegenerative disorder that causes the progressive destruction of nerve cells in the brain. In 1892, there was a patient from the psychiatric clinic that was 71 years old, and he was presented to have a progressive loss of language and a failing mind. After his death, Pick had the opportunity to do an autopsy and he viewed his brain. And in there, he was able to see an asymmetrical atrophy opposed to the typical diffuse atrophy that would be found in an Alzheimer's patient. Along with that, there was a severe shrinkage of the frontal and temporal portion of the cortex. So, a few symptoms present for the patient that had passed. This patient had severe aphasia and apraxia. Aphasia is a loss of ability to understand or express speech, and apraxia is a speech disorder that involves difficulty with muscle movement. So here we see a comparison between an average brain and on the right side, a brain that displays Pick's disease. You can see extreme shrinkage in the cerebral cortex of the brain and also the hippocampal area. There are also severely enlarged ventricles present. So, a few symptoms of those that display Pick's disease. Typically, a person from ages 40 to 60 will develop this, and they may experience extreme memory loss, disorientation, speech disorders, or tremors. Um, Again, I mentioned how patients can display aphasia or apraxia, and also, if you were to look into the brain under a microscope at the nervous tissue, you can see picked bodies form. So, in the figure on the top right, you can see the tau proteins, and basically, what happens is the pick bodies or tau proteins will develop inside a neuron, and when they do, they cause the neuron to appear spherical. Currently, there is no cure to Pick's disease, and there are no medications that can slow down the progression.